the actual massage, we use 3 different methods. The first one is to use the tip of your thumb. And we massage like this. If the person's skin is soft, then you can massage gently like this. The second method is to use the second joint of your index finger, and we bend it like this. Now, we usually use this method for a person whose skin is thick. In order to reach the reflex zones, which are deep below the skin, we may have to apply a certain amount of pressure. Now lastly, if the person's skin is especially thick and hard, then we use the third method, which is to use the first joint of your thumb. With this method, you can exert a lot of pressure. You can massage in an upward and a downward direction. This can penetrate deeply. The best and most efficient way to practice foot reflexology is to have 2 people, one person treating the other. Having another person not only makes it easier to practice the treatment, it also helps the patient to release the emotional stress during treatment by having someone else to talk to about it. By massaging the reflex zones, we can pretty well determine which part of the body is not working properly. Before we start the massage, we need to put some lotion on one hand. Then we apply the lotion directly on the reflex zone that you're about to massage. This is better than rubbing on dry skin, as it will prevent any unnecessary pain during the process. I usually begin the massage from the reflex zone of the solar plexus, then the adrenal gland, the kidney, the ureter, and the bladder. Now the kidney, the ureter, and the bladder are the most important. However, people tend to neglect the solar plexus and the adrenal gland. Therefore, my own practice is to start massaging from these 2 zones. Now then, the solar plexus zone tells us whether a person is under a lot of pressure or not, or whether the person gets nervous very easily, or whether the person is hypertensive. From here, we know how to help the person. Now, there are several different ways to massage. The simplest way is to use the tip of your thumb and massage the zones like this, either in an upward or downward direction. Make sure that you apply pressure when doing so. If the patient's skin is thick, then use the second joint of your index finger to massage downwards like this. This way, even more force is exerted onto the reflex zones. When massaging the reflex zones, you can also start from the bottom up, from the bladder to the ureter, to the kidney, to the adrenal glands, and onto the solar plexus. As you can see, the solar plexus zone lies deep in the center of the foot. I can see that my patient here is very sensitive in this area. We then move on to the zones for the thyroid gland. And then to the head. The thyroid gland controls the metabolism function for the body, making it very important. If a person is overweight, massaging the thyroid gland zone will assist in losing weight. Likewise, if a person is underweight, you would massage this zone to gain weight. Now, this indented area of the big toe is the reflex zone for the neck. Just above that is the zone for the cerebellum or brain stem. Further up are the zones for the temporal and trigeminal nerve. Somebody who's had a stroke is especially sensitive when massaging this area. And this is the way to massage the area. For someone who has neurasthenia, This area is especially painful during the treatment. If the skin is too thick, we can use the first joint of the thumb to massage this area in an upward direction like this. If it hurts too much, you should switch back to using the tip of your thumb. Make sure that you do not neglect the reflex zone for the neck, as many office workers often have problems in this area, as they have to sit for a long time. The top of your big toe is the reflex zone for the frontal sinuses on your head. If someone gets seasick, dizziness, high blood pressure or low blood pressure, or maybe thinking too much, this zone is usually sensitive. So we use the first joint of the index finger. See this? Just bend it like this, and then grasp the big toe with your left hand and use your right hand to press down on the area like this. People who have hypertension and dizziness feel particularly sensitive in this area, and because of that, it's only necessary to press against the area 3 or 4 times. Then rub your hand gently on it like this, and the patient will feel much better. I'd like to remind you of one thing. The reflex zones on our head are directly opposite to our feet, like a cross. Now, the right half of the head is in the left foot, and the left half of the head is in the right foot. And now, let's take a look at the zones for the pituitary and for the brain. The pituitary is the command center of our endocrine system. That means the pituitary influences our thyroid glands, our parathyroid glands, adrenal glands, as well as influencing our kidneys. Therefore, the reflex zone for the pituitary is very important. If the big toe is very soft, we use the tip of our thumb to massage it. If it's very hard, we use the first joint of the thumb to stimulate the zone. Only a few times is enough. Then rub the area gently. Next, the reflex zone for the right eye. This zone is directly underneath the second and third small toes. As this foot is quite soft, I can massage the zone with the tip of my thumb. For somebody whose foot is hard, we'd once again use the first joint of the thumb to exert more pressure into the area. Just like this. Next is the reflex zone for the ear. We can use the same technique as before.